Hello, this is Dr. Mark Hamilton in Indianapolis, and today we're going to talk about FUE, Follicular Unit Extraction. This has become one of the hottest terms in hair transplantation because of its reported benefits of allowing an easier recovery, a shorter recovery, and most importantly, no scar. Now, to take a look at the facts with FUE, let's take a step back and look what we've been doing for years, the strip technique. Traditionally with hair transplantation, we take a strip of hair from the back of the head for each procedure. And this strip is typically about 1 centimeter in height and anywhere from 5 or 6 centimeters for a shorter procedure to 20 to 25 centimeters for a longer procedure. Once we remove that strip, the surgeon closes that in a fine line and hands off the strip to the technicians to create the grafts for the transplantation. In the short term, patients with long hair can easily cover this area where the stitches are for the first 2 weeks while the stitches are in. Long term, however, this does leave a fine line scar. For patients with longer hair, this really isn't an issue. But for patients with short hair or those who want to buzz cut or even shave their head, that scar can be a real problem. So enter the era of follicular unit extraction, or FUE. With this technique, each graft is individually removed with a small 1 millimeter or so round device, kind of like this. And using this little punch graft, each graft can be individually removed. Following that procedure, just like a regular hair transplant procedure, the grafts are then transplanted into the front or areas that need to be transplanted. There are, however, several disadvantages to FUE. Number one, the process takes quite a bit longer than the regular hair transplant process. It's much more tedious, and the yield from each individual extraction is not as high as a strip technique. Probably the biggest disadvantage of FUE, however, is the cost. It typically costs anywhere from 2 to 3 times a regular hair transplant procedure. Because of this, for most patients, the vast majority of patients, the strip technique is still a better way to go. So who is a good candidate for FUE? Those patients who wear their hair very short or even shave their head will do better with the FUE technique. In addition, for those patients who have fairly significant hair loss or expect to have fairly significant hair loss and can't rule out the possibility that they may shave their head in the long term, I think FUE is a better way to go. Lastly, for smaller procedures where we're just doing a few grafts, less than 100 grafts, FUE allows you to avoid an incision and do a quicker process for those patients. So FUE is a new technique that I think for select patients can really have an advantage. For the majority of patients, however, I still prefer the more traditional techniques for hair transplantation. This has been Dr. Mark Hamilton talking about FUE, follicular unit extraction.